Your pet's dental care is very important because it will help prevent periodontal disease, which can be painful. The bacteria that actually lives in the mouth with the tartar can get into your bloodstream. It can affect other organ systems. So it can affect the heart, it can affect the liver, it can affect the kidneys. So it's not just, bad breath, it's poor health overall because of the toll that the disease takes on the body as a whole. I've worked under multiple doctors that were passionate about oral health, and I've really learned the advantages of maintaining oral health and the benefits, and it's just been something that I've also been focused on. And because of that, when I built this hospital, I made it a point to make sure that our dental areas were state of the art. I wanted the best, newest equipment out there. I wanted the best anesthetic equipment out there. I think a lot of people are scared of anesthesia for their pets. So, we have really nice equipment to help monitor all those vital parameters that we need while your pet's under anesthesia. And our technicians are trained very well in the monitoring of the patient. So I think we do a really good job at what we do, not only in terms of dentistry, but also in terms of anesthesiology. I'm so passionate about dental care because I see dogs whose teeth are falling out of their mouth. It's not fair that we wait until that point to help them because they can't tell us that they're painful. And what they're experiencing when their teeth are like that, it has to be significant pain. So I'm passionate because I don't want that for them. It's not fair to them. It doesn't provide quality for them. And there's prevention that you can do. So it's not like that's the way it has to be. There are key things to do to prevent that, and that's through home dental care, that's through routine dental care with professional cleaning, and it makes them much happier. Those dogs where their teeth are falling out, we get in there and we do the work that we do. We send them home, and most of the time the owners are so happy because they have their pets back, that they're like puppies again. They don't really realize the toll that it takes on them until we actually fix the problem. And then it's like hindsight is 20/20. Oh, that mouth must have really been bothering him, because now look at him. He's playing with his balls again. So it's something that we don't think about for pets. You have to look at it as kind of the same with us. It's a mouth for a mouth. Just because they're a pet doesn't mean they don't get oral care. We as humans will brush our teeth every day, 2-3 times a day. We go to the dentist every 6 months to have our teeth cleaned. We make sure we do everything we can to maintain the health of our teeth, because we know that it's going to benefit us for the long term. So our pets deserve that same opportunity. They can't tell us a tooth is hurting. They can't go in the bathroom and brush their teeth. We have to take care of them. So if you do routine care, it's really important, because then you don't get the progression of the disease, and they can have their teeth for their whole life. You're preventing the spread of the disease if you do routine care. So if If you're providing routine oral care on your pet and it's time for their dental cleaning, that dental cleaning may take half an hour, 45 minutes to do the x-rays, to scale, to polish, to do a full oral exam, and then they're up from anesthesia. If you wait, then what happens is the disease has progressed and you're in there not only cleaning, but you're in there extracting teeth and suturing extraction sites, and instead of a procedure that takes half an hour to 45 minutes to do, you have your pet under anesthesia for a good 2-3 hours extracting teeth and helping that mouth. So there's so many people that are afraid of the anesthesia, but if they do it routinely, I think it's less of a risk than if they wait a longer period of time. I think it's an increased, a slightly increased risk because of the length of time they're under. That being said, the risk is still fairly low, with the new anesthetic agents out there, with, the monitoring equipment, how we approach anesthesia, how we monitor patients when they're under anesthesia is a whole lot different today than it was, 3, 5, 10 years ago. So, dentistry requires anesthesia because one, it allows the patient to be still while we're in the mouth with sharp objects, potentially getting under gum line, treating the disease that's in that mouth. If they're painful, if they're wiggly, you can't do an adequate job cleaning teeth without anesthesia. At best, you can have you can provide cosmetic improvement where their teeth look good, but there's no way without anesthesia you can get under that gum line and get the disease that's going to advance whether their teeth look good or not. So, I think it's less stress on them. It's so much easier if they're under anesthesia to do everything that we need to do. I've seen dogs come in that have had anesthesia-free dentals that, the teeth look great, but the bone loss underneath the gum is significant and we have to pull many teeth. So it's not the best approach. A professional dental cleaning at an animal hospital is certainly a part of the oral care, but I think even more importantly is what you do for your pet at home. So brushing the teeth is a gold standard. If you can brush your teeth every day, that's certainly going to help. It's not going to stop the plaque from building up and the tartar from building up, just like it doesn't for us. You still need routine dental care or routine professional dentals for them, but it will help either maybe go longer between dental cleanings. It will help prevent, potentially the periodontal disease from occurring very suddenly. So brushing, there's a bunch of different oral chews that you can give your pets. One of my favorite chews is Oravet chews. They have an antibacterial component to it that as the dog chews, it mechanically works the tartar on the back of the teeth, sort of like taffy, but as they chew it, it releases the antibacterial component that will coat the teeth and work on tartar or plaque buildup everywhere. So it decreases the amount of bacteria that sits on the teeth and then prevents the plaque and tartar buildup. So it's the only chew out there that actually has that property. There's a lot of different chews out there, and it may help with the back of the teeth, but doesn't necessarily help with the teeth that they don't chew with. It can prevent, dogs can develop heart murmurs secondary to dental disease because the bacteria gets in the bloodstream. And one place it likes to go is on the valves of the heart, so they can develop heart murmurs, or it can potentiate a heart murmur. So if your dog already has a heart murmur, then that bacteria can get in there and sit on the valves of the heart and cause issues. So even for pets that have heart murmurs, even though the risk of anesthesia may be slightly higher, I think it's even more important for those dogs to have routine dentals, because that overall oral health is going to help the health of the heart.